Well, today on the show, we're at the Mississippi Institute of Weight Loss Surgery talking to Dr. Donald Balder. How are you, sir?
Good.
Good to see you again.
Yes, sir.
Let's talk briefly about, before we get into why we're exactly here, because ladies, you're going to love this. Guys, you probably will too. But let's talk a little bit about your background.
Yeah, so I've been doing weight loss surgery for over 20 years, general surgery. I did aesthetics years before I moved here and started to do aesthetics here again the last 3 years. We introduced our beautiful laser liposuction over a year ago. We've had amazing results over the last year and a half, and just want people to understand how much better this system is than traditional laser liposuction.
Okay, because I know a lot of people think going to get lipo, can be pretty traumatic to the body. I mean, I've known some people that have done that, but the laser lipo that y'all do, or the Beautifil, is a whole different ball game.
It is. The wavelength of the laser is set at the wavelength that dissects water, and so the fat cells are preserved at a much, much higher rate than traditional laser lipo. This isn't a power-assisted laser lipo where a lot of the fat cells are broken up during the process. These are preserved into a sterile canister, which then can be relocated. We can do a BBL by moving fat to the buttocks. A lot of people have these hip dips that they're not liking. We can fill those in. We can fill in breasts with or without previous prosthesis.
Really?
We can add fat back to the face because as we age, our faces start to drag downward because we lose our fat pads. So there's a lot of really great opportunities for people to get their look back that they're wanting to have, but also to get their bodies back, in shape for the spring and summer. We've done patients that work out every day in the gym, but still have a little mama pooch or daddy pooch that they can't get rid of.
And the older that we get, it's harder to get rid of that little
Correct.
daddy pooch or mama pooch.
Correct. We've done, every type of surgery you can believe with this device, and it works very, very well.
So you're talking about taking it out of one area, the fat out of one area, and putting it in another area and kind of molding it into place?
Yeah, so we'll take it, suction into a sterile container, manipulate it on the back table so that we can sterilely inject it into the areas desired, and it really, really works well. The fat transfer, the company says the fat transfer success is around 95%. I tell people it's probably over 85%, just expectations are appropriate.
But the fact that you're putting their own fat back into them, that's a positive thing too, instead of some, you don't keep fat stashed around somewhere.
Correct. So fat also has associated stem cells with it.
Right.
So as long as the fat is touching another fat cell, it's going to survive. And so it's a really nice, unique system. The other positivity is that we do this awake. So the patients are anesthetized with numbing medicine called tumescence. And so patients are awake. When we flip them over often, like the patient last week, they're texting their husband about how great things are going. And sometimes even getting
my stomach's gone. You're going to love my butt. I'm sorry. I had to throw it in there. So,
yeah, so it's a great system. It's a safe system. You don't have to fast overnight. You can come in after a meal in the morning and have the procedure done. Depending on where we're going, getting and where we want to go to, it takes between 2 and 4 hours. And we're never in a hurry. We take our time to make sure everybody gets an optimal outcome.
And so this is the little unit right here, the Beautifil.
This is the system we use. We connect our suction and our tumescence and our cannulas to this device. Our cannulas are a little bit smaller than the older fashioned power assist cannulas. Again, preserving and trying to maintain that fat cell integrity so we can transfer it now. And some people have chosen just to have the laser liposuction and not to transfer fat, and that's okay too.
So they can just go ahead and take that out and say, hey, the rest of me's fine. I just want it out of here.
Throw it away, yeah.
Throw it away.
Put it in the hazard container.
Sell it to the highest bidder. No, I'm just kidding. So let's talk about some of the other things that you do here as well.
Yeah, well, we offer a full range of aesthetics. We do facial rejuvenation with the Opus Plasma, which regenerates a youthful face again. We do facelifts using PDO threads, of course, fillers and Botox, all the toxins for rejuvenation of different areas. In addition to, the non-invasive M-Sculpt machine, which people can tighten up and build muscle with weekly sessions, and then the traditional surgeries that we do.
Now, jumping back to the Beautifil, this is something that I know this time of the year, ladies and men, same, they're wanting to get that that body ready that they can wear, sleeveless shirts. I mean, can you do it like under the arms?
Oh, sure. The bat wings, we
Yeah,
can do this. This
I
takes,
never heard that called.
this takes this away. So this takes the fat out, but also we heat up the skin, so the skin contracts over time. So in 3 to 6 months, most people have 75% of their contraction what they want. So it works really well with skin contraction in addition to removing the fatty tissues.
Bat wings.
And the fat tissue, once the fat cells, even when people diet, the fat cells are still all there. They're just tiny. So this is going to remove all the fat cells, and the only way you get them back is if you do the wrong thing eating-wise, because we are what we eat.
No, definitely.
So yeah, so it works really well. I think this is the best time of the year. Of course, we do these cases every season, but I think this is the best time of year to get scheduled because it gives you 8 weeks to prepare for your trip or your bikini or your event. And the healing is very, very quick. You have a little swelling for a few days, and
I have a lot of friends who are already out there booking cruises.
That's right. That's right. Lots of people are, and that's what we're hearing a lot.
So you get them in their cruise condition.
Correct. We got one coming in Thursday who's going on vacation with her husband in about 6 weeks, so she's excited.
Oh, she's going to surprise him, I bet you.
I think he's part of it. Yeah. Usually they are.
What do men usually? I mean, I know the women probably get the tummy laser thing. What about men?
So I've done men that have, again, some extra tissue that don't go to the gym, but then I've also done several men that are working out greatly and they still just aren't quite, can't get the rest of it out. And so we'll do the 360, the abdomen, the sides, and the back.
And the older that we get, the harder it is to get rid of that.
Oh, it is.
I mean, I know.
It is. And we also do medical management for people if they need help with diets or hormone health. We do all those things here in the office to optimize people 100%.
Now, how does someone find out if they're eligible for something like this? I guess make an appointment with you.
That's
for
right.
A consultation.
Yeah, we just do a consultation. The consultation fee is very inexpensive, and the consultation fee goes towards the price of the procedure.
Wow. So again, there's so many different things, and you have a website they can go to.
We do.
And you can find out a lot more information about all the different type of services they do provide here at the Mississippi Institute of Weight Loss Surgery. Dr. Balder, it's good to see you again.
Yeah.
And I may be calling you here very soon. You're located in Gulfport off of Community Road, and just right behind the Cinemark Theater.
It is.
Across the street from there. So if you want some more information, you want to get yourself into great shape for the whatever season, gown season, swimsuit season, or whatever, give them a call here at the Mississippi Institute of Weight Loss Surgery.